So welcome, everyone. My name's Hannah Vaughan Jones, for those of you who don't know me from previous global health events in the past. I'm delighted on behalf of the World Health Organization and, of course, Bloomberg Philanthropies to welcome you all here, to those of you joining us here in the room in Geneva and those joining us virtually as well from around the world. So welcome to you. Now, the global health community is, of course, still rightly focused on containing and controlling COVID-19, but there are still a huge number of other health challenges that were here long before the pandemic, and they still, of course, persist today. Non-communicable diseases, we're talking cardiovascular diseases, cancers, chronic respiratory diseases, diabetes. These kill millions every year. They account for what I think is an astonishing 2/3 of all deaths, and yet they only receive 2% of all funding for healthcare in lower middle-income countries. So this evening's focus, this discussion, is about the impact of COVID-19 on NCDs. What can we learn from the pandemic to further enhance NCD control? What impact has the pandemic had on NCDs? Has it exacerbated them, concealed them, potentially even prevented them, perhaps in some cases? So to kick things off tonight, we are going to hear first from Mike Bloomberg via video, who is, Mike is of course the WHO Global Ambassador for NCDs and the founder of Bloomberg Philanthropies. And I believe then Mike is going to introduce his good friend, the Director General of the World Health Organization, Dr. Tedros as well. So some videos first.
Hello everyone, and thanks for coming. It's been nearly 3 years since we last held this event, so there's a lot to cover. Before the first cases of COVID-19 appeared, everyone in this room was focused on fighting a different pandemic, one that wasn't getting enough attention, non-communicable diseases. And it's still not getting enough attention. Globally, NCDs like diabetes, cancer, and heart disease account for 7 out of 10 deaths. And during the pandemic, people with those conditions have been more likely to be hospitalized or die from COVID. NCDs harm our economies too, by robbing nations of talented and hardworking people. The good news is, smart policies can solve this problem. We just need the political will to implement them. So thank you all for building public support for those policies. And let me give a special thanks to Dr. Tedros and his team, and Dr. Kelly Henning from our team at Bloomberg Philanthropies. A healthier world is on the horizon, and working together, we can make it happen. Enjoy the discussion and have a great evening. And now I'm going to pass it over to my good friend, Dr. Tedros.
Princess Dina, Dr. Kelly Henning, Ambassador Røttingen, Excellencies, dear colleagues and friends. 500 years ago, the Dutch philosopher Erasmus said, "Prevention is better than cure." As the pandemic proves, humans are slow learners. Non-communicable diseases account for more than 70% of all deaths globally. COVID-19 has taken a heavy toll on people living with cancers, heart disease, lung disease, and diabetes. And yet, for decades, they have been overlooked and underfunded. The pandemic has severely disrupted services for NCDs, impacts that will be felt for years to come in health systems, economies, and most of all, households. Investing in prevention can be very cost efficient and could save nearly 7 million lives by 2030. WHO's best buys include 16 evidence-based policy interventions that will save lives and save money, like graphic warnings on cigarette packaging, food labeling, and bicycle lanes. We need to change our approach to address the root causes of NCDs in the food people eat, the air they breathe, and the conditions in which they live and work. Investing in prevention and treatment of NCDs is a vital part of every country's journey towards universal health coverage. But it's also important for protecting people with NCDs against the impact of epidemics and pandemics and building more resilient health systems. We call on all countries at all income levels to make a paradigm shift towards promoting health and preventing disease in communities based on strong primary health care. I thank Mike Bloomberg and Bloomberg Philanthropies for their tireless efforts in the fight against NCDs. I thank you.
To Mike Bloomberg and to Dr. Tedros, of course. Just for the format, so you know what's going to happen over the course of the next 45 minutes or so, we are going to have a panel discussion. I'll introduce my distinguished guests in just a second, and then there will be an opportunity for Q&A, questions and answers. So as and when we get to that portion towards the end of the discussion, there will be microphones going around. So if you do have a question, please just raise your hand and state your name and organisation and who your question is for. Someone will come and pass a microphone to you. So to our panellists, we have Dr. Kelly Henning, who is Head of Public Health Programs for Bloomberg Philanthropies. We have Dr. John-Arne Røttingen, Ambassador for Global Health with Norway's Ministry of Foreign Affairs, and Dr. Maria van Kerkhove, who is the COVID-19 Technical Lead with WHO. Welcome to you all. Kelly, I'm pretty sure yours is the only name that I pronounced correctly then. So with that, I'll come to you first. And I hope everyone's happy with first name terms. And John-Arne, that might still be a problem in terms of my pronunciation. So Kelly, perhaps an unfair, or at least certainly a tough first question to you. Everyone, of course, has been fixated and focused on COVID-19 over the last couple of years, and yet you've been leading on non-infectious diseases. Has that been a hard sell at times? And did you ever think of jumping on the COVID bandwagon and changing tack within Bloomberg?
So that is a little bit of a tricky question, but we actually have very much stuck to our priorities of working on non-communicable diseases and injury prevention. But that said, we did take the opportunity to use the connections and the grantees that we have in some of our programs to also address the COVID-19 pandemic. So just as a couple of examples, in our Data for Health program, which is a program that supports ministries of health in their attempt to strengthen birth and death registration and to use data in the ministries for policy change, we really provided a lot of technical assistance to those countries we were working with to look at excess mortality in the face of the COVID pandemic. So that would be one concrete example. We also did some funding things. We funded work with New York State, actually, with Johns Hopkins University to post a training course, a modular training course on contact tracing that was free and available to anyone in the world. And we actually had literally millions of downloads of that program. We funded some work in sub-Saharan Africa to address COVID through some partnerships that we had already existing with some partners. And we did a few other things like that. We pivoted some of our city work because the cities were really addressing COVID in a very frontline kind of way. We had always been working with them for the last number of years on NCDs and did some small grants for COVID work. And we've now pivoted back those programs to NCD focus. So yes, we've done some COVID, but we've never lost sight of the NCD work.
And I guess the whole point of this conversation as well is to say what lessons can be learned from COVID as well. And certainly it seems that from what you've just described that Bloomberg Philanthropies has been making sure that you learn as much as possible and take that forward. Maria, if I can come to you on that point, I mean, you sort of are the face of it and I don't mean that in a bad way. I mean that in a very positive way. What would you say have been the biggest lessons learned around infectious disease prevention that can be applied to non-communicable diseases?
Well, first, thanks for having me. They're completely interlinked in my view. I mean, my background is in infectious diseases, not in non-communicable diseases, but they're linked because in every infectious disease, people who are more at risk for developing severe disease, more at risk for dying, are people with underlying conditions. And this is something that seems to surprise us each time, or seems to surprise the world each time, and then we remember, oh, we really need to focus on this. So for me, the lessons that need to be learned remain the same each time. What I am concerned about is whether we will actually apply those lessons going forward. So we're still in the middle of this pandemic, whether we like it or not. So how are we actually using the current event that we have to build the systems that will actually address the underlying conditions which make them worse? And part of that is addressing non-communicable diseases. So we have to learn and relearn, but apply those as we go through it. It's not like the event ends, you learn the lesson, and then you rebuild and start. It has to happen while you're actually going through it. So quite a lot.
I mean, are you positive, though, about the kind of the signs that people are kind of taking more note and having sort of more early warning systems in place?
I think so, but we live in this system of panic and neglect, and we're still in this, and we're in a system of panic and neglect. Because I think people are so tired of talking about COVID-19. I am as well. But we have to keep dealing with this because people are dying unnecessarily. And the people who are dying are the people who do not have access to vaccine and people with underlying conditions. So when are we, if we're not going to learn this now, when are we actually going to learn? I am hopeful, but I need to see more. We need to see more, less words, more action. And I'm hopeful because I can see that happening. It just needs to be sustained.
And John-Arne, Norway, I know, has a fantastic record for supporting work on NCDs, particularly in lower middle-income countries as well, and we'll come on to that in a second. But I'm wondering, in your country, in Norway, did you see any specific correlation between the unfolding pandemic and non-communicable diseases?
Definitely, and first I should say that we have fared fairly well in Norway regarding the pandemic, so been in a very fortunate position. And thinking now what I'm also hearing, what can we learn for sort of the longer-term prevention efforts? It illustrates that health is also about policy and politics, because we couldn't have done this without quite a strong culture of political consensus, a collective sense of urgency and collectivism in the society, trust in society, trust between populations and government. And in many ways, we need those sort of conditions around measures around NCDs, definitely in the longer run as well. So let's also take those sort of learnings with us into the future. But specifically on your question, of course, we saw the same, but even though with our fairly low case numbers and at least severe cases, they were definitely, of course, higher in those with chronic conditions, those with diabetes and other NCDs.
So the same as the world over. Yeah, exactly. Kelly, I mean, Bloomberg Philanthropies has long funded programs on NCDs. I'm wondering if you think that the COVID-19 experience has upped the momentum for interest in and a desire to deal with NCDs, or whether it's overshadowed them. Has the pandemic been a beneficial learning tool, not just in hindsight, but also through the process as well?
I think it's a little bit early to say. I mean, we're just sort of getting through this COVID experience and trying to see what countries are going to prioritize now at this stage. NCDs don't have that same, we don't have that same sense of urgency around NCDs that we do around the infectious diseases and certainly around COVID. Will that sense of urgency rise, and will we see more political will, as was mentioned? I certainly hope so. We have lots of information now that we need a healthy population to handle these emergencies. So hoping that message will really get through.
Why do you think it is that there isn't that urgency, given the number of deaths? 2/3 of all deaths are from NCDs. Is it because so much of these diseases are caused by sort of lifestyle factors and choices and things like that, be it smoking or the environment and the like? So
there's a lot to say about that, and I think there's probably a lot of people in the audience who have perspectives on that as well.
Get your questions ready.
I think, certainly the chronic nature of these diseases, the fact that there's not an acute event, there's a perception that these are diseases of the elderly, and they're inevitable, which is not the case. We're talking about relatively young people experiencing, certainly during productive moments of their life, having diabetes, having obesity, having smoking-related diseases. But that's a perception that we have to overcome often. And I think there's just a lot to grasp. And what we really want to concentrate on is that these are preventable conditions, and there are interventions that can work. And so the more that we all rally around that, the more successful we'll be.
And Maria, you've had so much involvement with and contact with like various governments and the like, and probably more than you care to remember over the last couple of years, through press briefings and all the rest of it. But I'm wondering how confident you are that now that governments and the public sector is going to take NCDs more seriously in terms of the fact that they are treatable, that they don't have to be around, that there is a potential way of ending it.
Well, I mean, I certainly see much more attention to this. I mean, we have an acute event right now with this global pandemic, and we've seen all of the different factors that contribute to making it worse. Part of this is underlying conditions, where we know that people who are most at risk, these are people who are going to need health care, they're going to need hospitalization, they will need ICU, and many of them will die. But it also links to the trust in communities and the systems that are in place beforehand. I'm hoping that there's much more attention to this, but again, it's not just about what you do in an acute event. It's how you use that acute trauma to actually build systems to make it better going forward. So we have seen many countries around the world do that. In fact, this pandemic has affected every single person on the planet. And it is something, whether you've had COVID, someone has died from COVID, your life has changed, your future has changed. Think about young people and the course of their life and what's different there. So how did we use and how did governments use the investment, the attention, the political attention as well, to address some of these facts, not just the infectious disease itself, but a lot of these underlying conditions. So we do see some movement in that. It's just, will it be sustained? That's the big question we have.
And now we have, of course, a lot of political interest on preparedness and how to be better prepared. But I hope we can avoid it sort of either or priority setting and issues around it, because, of course, we need both to have the narrow mindset on preparedness. We need better lab capacities, sequencing capacities. We need better ways to detect and then stop outbreaks early. But we have definitely seen that when an infectious disease is really spreading in society, those are not the determining factors. So the very few of the indices, the indicators that have monitored sort of that narrow spectrum sort of preparedness, they do not predict how countries have fared in the pandemic. And that's because it's the broader sense preparedness, it's the population health, it's the ability to have a good public health system where actually you have been able to reduce the burden of non-communicable diseases. That is a part of that broader preparedness. And how to keep that agenda alive, it's difficult, because some will then say, okay, now you're putting everything onto my tree, my Christmas tree. And this is something we hear these days. We need to focus. But yes, we need to focus, but I think the focus needs to be health. And then what are the best and most important interventions to work on for health?
Talking about Christmas in May, Kelly, over to you.
Yeah. I just want to mention, that one of the unique aspects about working in the NCD area is that we really do have an opposing industry in many cases. So it's not just about individual choice. It's not just about, lifestyle. It's really what is enabling people to have a good lifestyle. What is enabling people to make healthy choices? And that work really is can be quite tough at country level, because we do often have really strong industry pushback, and that's a little bit different than what we face in the pandemic space. So I think it's important that we put that out there.
Yeah, and I think it's one thing as well to have a government looking out for its own domestic population. It's a whole other thing when you're asking them to invest in a foreign population as well. And I know, John-Arne, that Norway has included NCDs in its overseas aid budget. Why, and how can you encourage others to do the same?
I think in a way it comes from the natural sort of evidence-based approach to what are the priorities, because we set the Agenda 2030, the Sustainable Development Goals. The health goal, SDG 3, is about maximizing health. Then we need to understand the disease burden. You talked about deaths. I don't like that much talking about deaths, but it's more important to understand where can we improve life and the livelihoods of individuals, so reduce disease burden, and where do we have the best buy-ins, the best buys, the most cost-effective interventions. And then NCDs will come up in any sort of rational priority setting exercise. So that is a main driver. The challenge is that we have limited resources, and the challenge then is we tend to focus on specific interventions, and we tend to have organizations that focus on specific interventions or specific diseases. Even the term non-communicable is not very good in the sense that it's already setting up the dichotomy between the others over there. They work on communicable, we work on non-communicable. That's the wrong approach. We need to understand that a rational health minister in any country, we need to understand its disease burden, need to understand, given my limited resources, where should we start?
Yeah.
And definitely population health measures, prevention, delaying disease, taking even interventions that can save you your fiscal space a bit by increasing taxation, but where you have opposition from industry, that's the rational choice. And how can we help countries making those rational choices?
And Kelly, then how do you, if you're going about trying to convince public sector, private sector to come on board with NCDs in terms of funding and support, what's your biggest argument to get people to join the movement, if you like, and find the opportunities?
Yeah, so, well, for Bloomberg Philanthropies, it's really about the data. It's really that the data, as has been said repeatedly here, the burden is enormous of non-communicable diseases. The connection to outbreaks, to infectious disease, morbidity and mortality is increasingly clear. And I think, you know, the data really bears out the need to go in this direction, and the fact that there is some industry pushback does scare off donors sometimes a little bit, but I think we've shown that there's a lot of opportunity. The tobacco industry is a very strong industry, for example, but working with WHO and other partners, you know, literally hundreds of countries now have comprehensive smoke-free laws. Tobacco tax is on the agenda of a number of ministries of finance at this stage. There is possibility for progress, and showing that there is possibility for progress in NCDs, I think, is important, that it can be done.
Yeah, and so Maria, coming to you then, public policy aside, what do you think has been the public's biggest takeaway and biggest lesson from the COVID-19 pandemic? And what's been your biggest takeaway, other than the need for a sabbatical?
I mean, how much time do we have here? No, can I just come back very quickly to this
Yeah,
either or dichotomy? I mean, one of the things in the pandemic we've struggled with is a dichotomy. It's either this or it's that. It's either containment or it's mitigation. It's either...
It's the binary nature of all of our conversations at the moment.
It's the binary nature of everything. But the idea that it's NCDs or communicable disease is false. And we all know that in this room. But I think for priorities, for time, for people's time, it's still quite tangible. It's still quite present. So what I hear all the time is, when can we stop talking about COVID and go back to talking about this or go back to talking about that? And that just completely sets us up for that separation again. So with these silos of work, with these competition for time, attention, financing, pits us against each other. So I know everybody in this room doesn't feel that way, but I think in everything that we do, in the roles that we have to continue to make those connections because they're completely interconnected. There's so many takeaways from this pandemic, and so many takeaways I'm sure that the public have, but I think it all comes down to trust. It all comes down to trust. I did an event earlier today, and that's all we talked about. You know, you can have the best communication, you can have the best plans, you can have the most financing, but if you don't have public trust, and if you have poor leadership, you don't have anything.
Yeah.
So it's been a challenging couple of years, and it's changed. Things have changed. Our messaging has changed. The world has changed, and that's a very difficult thing to communicate. But if you don't have the people with you to be able to say, okay, here's why it's changed, here's what's different, here's where we're going now, here's how you keep safe, and then you could believe that in the person saying that, then you're really kind of lost.
So one of the ways, I suppose, to build trust is, as you say, have public figures coming out and saying, these are the facts, this is what we know, this is what you need to do. You know, and I wonder if you have a perspective on how you bring more public figures, be they politicians, celebrities, whatever it might be, onto the kind of the NCD cause.
Yeah, no, we need champions, definitely.
Exactly.
And those, ideally, those champions should be national champions, because I believe that the only long-term sustainable strategy for health is national ownership and a national agenda. And I think we've seen that in COVID. We need champions, and we need, if politicians cannot be those champions, and we have seen that in some countries, then we need strong public health professionals that take on an advocacy and a champion role. The question then is, how can we bring those agendas into every individual country? I see definitely the pandemic as a big opportunity, or the learning from the pandemic, to continue a big focus on health. I've been working, at least in the last part of the pandemic now, very much with Africa, and the way the African Union has really consolidated their work on health, collaborated, established a very strong sense of urgency and the need to actually take care of their health systems and the healthcare themselves. I think it's at least a very good platform and a starting point. We need to ensure that it's sustained, but they need to ensure that that is sustained. We cannot come from the global north to tell those stories. But I think that this is now so ingrained in understanding of every politician. I haven't thought about it, but in a way, this is a potentially a positive consequence of the vaccine nationalism that we have seen internationally. So in a way, some nationalism has then caused every nation to understand health is our agenda. We need to take care of it. I don't say that countries should do this alone, because the only sustainable effort is to do it together. But I think at least we have an opportunity. So those political leaders, I think those are the champions, and should be.
Yeah, and before I come to my sort of big final question to trick all of you, no, Dory. Kelly, a question for you then. What do you hope will be the lasting legacy of COVID-19 on NCD prevention?
Well, I do hope that this does give governments an opportunity to recognize how important NCDs are to address in their policy plans, because there's no question that there's been this very acute and overwhelming moment where NCDs have played an important role in some of those very negative outcomes, but we now have the opportunity to really go forward and address them.
Okay. So the final question that I have is, actually it happens to be the title of Bill Gates' latest book, How to Prevent the Next Pandemic. Everyone's got their own theories on it, but in a few sentences, Maria, how do we prevent the next pandemic?
I don't think I've ever answered a question in a few sentences. I mean, there's so much. It isn't a short answer. There's a lot that needs to be done. I think everybody recognizes that pandemic preparedness is a constant. It's not something that starts and stops. It's about investment. It's about making sure that we have the systems in place to be able to detect. But not only that, to be able to take action to potentially mitigate, to prevent things that are small from becoming much bigger. But it's also about addressing the underlying inequities that exist. We haven't really done this at a global level. There's a lot of attention to this at the moment, but that requires investment as well. So everyone has their theories of how we prevent the next pandemic. There will be another pandemic, I'm sorry to say. Yet we're still in a pandemic as we speak about the next pandemic. So if we can use the situation that we're in right now to actually invest in those systems, sustain those systems, we will be in a better place.
So health equity, health infrastructure improved across the board will help, at least.
It will help.
Okay. John-Arne?
Yeah, so avoiding repeating what Maria said, I think the question is wrong in a way, because we need
tell
to,
Bill Gates' publicity team.
No, and I can pay, and he can pay me for that. We need support, everyone. My point is that we need to take all steps. We need to try to avoid spillovers becoming outbreaks. We need to avoid outbreaks becoming epidemics. We need to try to avoid epidemics becoming pandemics. But as Maria said, we cannot avoid a new pandemic. There will be new pandemics. The next one, most likely, some form of influenza. And the point then, how are we prepared for that? How can we respond? I've been working very much on the Access to COVID-19 Tools Accelerator for the 2 years, given Norway's role together with South Africa as co-chairs of the Facilitation Council. What we see now is that now, of course, after we needed to develop the technologies, we needed them to ensure sufficient production. Now the challenge is delivery, and the challenge is delivery in countries. And to me, that speaks to the need of investing in primary healthcare, in health systems, in capacities. That means that you can handle a new pandemic, a new epidemic, but you can also handle your daily health challenges. That is enormous in all countries.
Kelly, the final word to you on this.
So I won't repeat anything that's been said. I have the epidemic experts on my right and left, but I think we also have to remember we want healthy populations, and a lot of the healthy population work does come from prevention. So it is a good moment to be working on NCDs in parallel to all these other things that have been mentioned, and I think that's the point of our conversation. So
Okay. Thank you very much to all of our panellists. It's time, we have got some time for Q&A, so if you do have a question, please, the gentleman here has just raised his hand, so if you can just keep your hand up so that they know where you are. If you wouldn't mind just saying your name and then who your question is for as well, thank you.
Of course, thank you so much. Good afternoon, everyone. My name is Ricardo Leite. I'm a member of parliament from Portugal, and I'm here representing Unite, of which I am president, which is a global network of parliamentarians committed to global health. And as a practicing physician, having gone back into the front line during these last 2 years, my first words is of thanks to all of you who are representing so many others that have done such a great job. And honestly, I feel, if you allow me, I think everyone should give an applause for the amazing work you've been doing over these last 2 years. If I may, I just have a quick comment and a question. The comment is, following what you're saying, I think it's very clear to everyone how everything beyond COVID, be it infectious diseases or not, has been in a way, and health systems across the world, left behind. And we are seeing in many parts of the world, you know, Unite is present in more than 80 countries. We are seeing the challenges still today on dealing with these challenges. And looking forward, new pandemics will inevitably happen. The question is, are we going to be better prepared? And so that's why, you know, we are working so hard, everyone is working so hard towards getting a legal binding document, be it a treaty, a convention. We don't really care what you call it as long as it works. But we do need to have something in the political space that works at the national level, as the ambassador was saying, that makes sure that we are better prepared to avoid what we are facing today and to not look back, you know, the way we look back at 1918 and ask ourselves, why are we repeating so many of the same mistakes 100 years after? The question, though, is as a network of policymakers, as we are, we do not want to make any scientific content. We base ourselves on organizations like WHO, on your recommendations, and what we do is we strategize politically to transform recommendations into concrete policies on the ground in the countries. So looking forward, looking at the lessons learned in terms of prevention, both in NCDs and infectious diseases, what would you pinpoint as the main priorities for the years to come for parliamentarians, for policymakers to focus on transforming health systems so that we are better prepared to respond to the needs of the people? Thank you.
Thank you for your question. I don't know if it was anyone in particular. Take a pick. Kelly, do you want to?
Well, I can speak probably mostly to the NCD piece, and I'm sure my colleagues would like to talk about the pandemic aspects of your question. But parliamentarians are incredibly important to the work that we do at country level always in trying to work on prevention for NCDs. So WHO has excellent policy packages that are very evidence-based and that would benefit each and every country if they were actually put in place. So in the tobacco control space, these are things like smoke-free public places, tobacco tax increases. In the food policy space, front-of-pack warning labels on unhealthy food, sugary beverage taxes, etc. So there are those packages. They are very well thought through. They are very under-implemented. They are very, very rarely brought forward. So I think that is a role that would be fantastic for your organization to take on. But Maria, you may have... And
John-Arne wanted to say something.
Yeah, no, just thinking, you are a parliamentarian, you are probably in a committee, but you are still responsible for the totality in a way as a democratically elected politician. I sit now in a ministry, and I must say and confess that I was a bit surprised of the level of silos between different ministries in governments, and I think this is not particularly the case in Norway. I think it's a case in most countries that in the executive branch of any government you have responsibilities. They are line responsibilities. You have ministers competing for their causes, and the challenge of health is really a multi-sectorial challenge, and in particular talking about the NCD agenda, because there are trade-offs, there are industry interests, there are agricultural interests that may be opposed to your health agenda if you're a health politician. The only way to resolve those are real political discourses and discussions and trying to take it head on. And parliamentarians can do that because in parliaments. So that would be number one. And then number two is the fiscal space for health. We have tremendously differences in domestic investments in health. We have the Abuja Declaration for 15% of general government expenditures. We know that many countries, even fairly rich countries in Africa, are down at 5%. We also know that there are big differences among middle-income countries and high-income countries in the willingness to invest. And I always, even though the finance ministry tend to say expenditures, I always say investing in health, because the long term this is good for the economy. We need productive societies.
And Maria, any thoughts on the priority policy areas going forward?
Well, my role in this pandemic has been on the evidence-based, developing evidence-based guidance, which is very different than setting policy. And so I think what is important is that we have those strong evidence-based guidance and then support national governments to set the policies that fit. And that's complicated because health is only one aspect of what needs to be addressed. And the pandemic has highlighted how much this invisible pathogen has affected every aspect of that. And I think for us, for myself, speaking in my particular role at WHO, appreciating the differences between setting that guidance to what the policies are in country and then communicating that, implementing that, and how that changes over the course of a pandemic there's a lot to be learned there. And I think the timing in which decisions are made are also quite different from the political side versus from the science side. And I think we have a lot to learn in that space as well, because the timings are quite different. But the responsibilities to take those policy decisions go way beyond that particular evidence that my team, for example, is responsible for.
Okay. Another question, I believe there's a microphone already handed over. Hello, hi.
Thank you. My name is Bente Mikkelsen. I am the NCD director here in Geneva, WHO. So first of all, I would like to give a very warm thank you to Bloomberg Philanthropies. And both the philanthropy itself, but also the ambassador, is extremely important for the NCD space. So it is more than ever. Thank you very much. And I think we heard his very crisp message as well. So at risk, untreated, unprotected during the pandemic. And I think that the end game tobacco is still not done. So thank you very much. But I would like to comment as well, and I would like to also extend a thank you to the government of Norway and to the president of Ghana. And this is coming back to what happened now during the pandemic. It has been an awakening. So that's the reason why we had the meeting now in Accra, Ghana, leading to a heads of states and government group that will meet every year on the Global NCD Compact. And I think this is needed. And the reason why we see this is, of course, what has been mentioned, that there will be no preparedness for any humanitarian crisis or pandemic unless we have NCD included into UHC and focus on prevention. And I think as long as this is clear, it is a really positive thing. Another thing I would like to say that is for the first time in WHO, we are also now at the table in the day-to-day management of the Ukraine crisis. And this is, again, I would say, a recognition of the people living with. My last comment before my question is that as much as we like to speak about integration and health systems, what happened during the pandemic was actually that the people living with NCD were calling WHO. They were shouting and saying, people living with diabetes, with cancer, with cardiovascular diseases, and cardiovascular diseases is actually the one suffering. So as much as we like to call it health, underlying diseases, NCDs, I think we need to also focus on the people living with and the name of the risk factors. We cannot make it a soup because we have to be very specific. My question, I think, goes to John-Arne. And you spoke about solidarity, and you spoke about innovations like Act A. How would you see this sort of flow through the whole area of health, and how can this be useful for NCDs as well? Thank you.
So my diplomatic answer would be that we will do an independent evaluation of access to COVID-19 tools accelerator, and then that evaluation would inform member states' deliberations on what we can set up as a long-term sustainable mechanism to coordinate in future crises.
The less diplomatic.
The less diplomatic answer would be that I think we actually have seen an unprecedented willingness to coordinate and collaborate among global health agencies and organizations that normally do not have that level of interest in collaborating and being a part of the same implementation, because they are also competitors, and in particular competitors for resources. So I think if we can really maintain a strong sense of the need to coordinate and collaborate when it comes to implementation and working with countries, and to do so, I think we need to be clear on that expectation for the totality of agencies. And my reading of the landscape now is that everyone sees the need to think more holistically and think more long-term, as I said, on how we can support primary health care and better capacities in countries, and then use the existing structures we have, but then use them together. So some level of a stronger commitment to that, I think, is important, not only for pandemic response capacities, but actually in general for improving health.
I think we've got time for just one more brief question. So yes, I think there's someone there. Sorry. If you could keep your question quite brief, please, sir, that'd be great.
Yes, sorry, but it was...
Oh, sorry. Hello.
No, I was with the mic. Sorry, my name is...
You've got the microphone, you're in charge.
The microphone, you see. My name is Adriana Blanco. I'm the head of the Convention Secretariat of the Framework Convention on Tobacco Control. So first of all, thank you, Norway, that is one of our donors too, and to all the colleagues that are in the panel. But really, I think that there is another dichotomy, I think, that we are saying, and it's prevention versus treatment, preparing the health systems. And I really need to say, especially to the parliamentaries, that we have this treaty that has been in force for 16 years and still is far from being implemented in the countries. And you are hoping that this new pandemic treaty will help you, but treaties are only as strong as the implementation at the country. And parliamentaries, you are in the best situation to really make this a reality. And for prevention, there is no need, so much need for money. The thing that is really important is the political will. And we need that from countries. And really, mine is not a question, it's just this comment. And thank you all of you. Sorry that I took the panel place. But
you have
really,
the microphone.
Really, we need to have this commitment from countries. Thank you.
Thank you very much. Well, let's leave it there then, and thank you very much for having the final word on it. But thank you so much to Bloomberg Philanthropies. Also, a huge thanks to World Health Organization as well. The World Health Assembly is, of course, just about to start. NCDs are already on the map. They are overrunning the map at the moment, but it seems that much more can and certainly should be done in order to try and counter these diseases. And there's nothing like a pandemic to really focus minds on what can be done when we all collaborate and actually come together. So thank you very much for all being here. My thanks also to my guests, to Dr. John-Arne Røttingen, to Dr. Kelly Henning, and also to Maria van Kerkhove.